Hi everyone, Dr. Ariel Ostad, cosmetic dermatologist. I wanted to talk to you about nose augmentation. There are patients who present with basically unevenness of the bridge of their nose, whether it's something that genetically they're born with or they've had plastic surgery, rhinoplasty, and they've left with still a hump. I've seen both of those cases present to my practice multiple times, and one common method that can easily be used to actually improve and straighten the bridge of the nose is with the use of hyaluronic acid fillers. The nice thing about hyaluronic acid fillers is that we can actually use it to really sculpt the bridge of the nose, and it's something that's quick. It's done basically without any anesthesia. We go ahead and just use my artistic skills to know exactly how the bridge should present and how it should look, and we basically go ahead and inject the fillers. These fillers typically last roughly around 9 months to a year without doing any surgery, and patients can walk out without really any evidence of any bruising, and you can kind of see the nice correction done really well. It's something that we don't overfill. There's certainly a lot of facial anatomy awareness that is required to make sure that the filler is placed in the right plane, that is not injected too superficially or too deep. So that's something that I'm proud to say I know the anatomy quite well, and we know exactly where to inject this filler. Thank you so much. If you have any questions, feel free to reach out.